It's nice to see everybody today. I'm Emily Haddad. I live in Fort Worth, Texas. I'm very passionate about caring for children and families with bladder exstrophy. And I'll speak first on our conference theme, and I'll be followed by Dr. Zarash Montano. So the conference theme is coping. What is coping? The definition of coping is investing one's own intention, conscious effort in dealing with external stressors. It's minimizing and tolerating these stressors and these conflicts and difficult dynamics in our lives, and using strategies to reduce the stress that we all endure. There's a level of stress that every human experiences, right? Whether it's how am I going to get food and beverages that I need, how am I going to obtain housing, how am I going to manage my finances, how am I going to succeed in school, succeed in my career, succeed in relationships, right? So there's a baseline level of stress that we all endure. Sometimes this level of stress becomes unmanageable, but we all find different ways of coping. Coping can be listening to music, playing music, it can be calling a friend, it can be overeating, it can be over-exercising, it can be going for a gentle run that's healthy for us, it can be painting, it can be avoidance, it can be adaptive in a way that's helpful to us and will promote and nurture a healthy balance, or it can be what we call maladaptive. So overall, in the long term, not helpful for us. I've had the privilege of working with a lot of patients and families with bladder exstrophy and cloacal exstrophy. And I've learned from them, as you all are the experts, that there's certain things that people with a chronic illness or with bladder exstrophy experience. So there's different ways that we've learned to cope, and sometimes these ways work for a while and then they don't work any longer. When the child is initially born with bladder exstrophy, as Pamela was discussing, there's a lot of uncertainty. The general public isn't aware that bladder and cloacal exstrophy are a natural occurrence. So you're learning about this condition and you're trying to cope with understanding the medical information, the medical terminology, and negotiating the healthcare system. There's a lot of uncertainty about what your child's going to experience in their life. There's fear about how they're going to manage this, how they're going to adapt, how they're going to adjust. And unfortunately, this can feel very isolating. One of the most profound experiences I've had is being in a ward of 150 families in India, all caring and helping each other through bladder closures and bladder augmentations, and caring for each other, and then returning back to the United States where one family was alone in one room, isolated and by themselves. And that's why you bringing your family here today is so important and so profound, because you're providing your family a community where they know they're not alone. Unfortunately, teenagers feel alone all the time. There's a lot of feelings that develop during that period of time where you feel like a lot of people don't understand you, and this is very normal. And so having bladder exstrophy might make that feel more pronounced. There's a lot of additional anxiety and stress that people with bladder exstrophy experience, and I'm sure you all can relate to some of the things I've heard from my patients. When they get to work, when they get to a field trip, when they get to school, where are the restrooms? Do I have enough catheters for the day? What do I tell people if they notice that I'm using catheters and they see them in the trash can? Will my teachers let me use the restroom when I need to use it? What if there's a substitute and they don't know my medical treatment plan? How will I get a job in the future that will allow me to use the restroom every hour, every 2 hours like I need to for my treatment plan? What are people going to notice if they see that I'm wearing a diaper or a pull-up? What am I going to tell my classmates if they question me about this? How am I going to explain my scars? Many different fears and anxieties that are related to having a chronic illness in general, but having bladder exstrophy. I've learned many different ways from my teenage patients who are very creative about how they've responded to these anxieties. I have one teenage boy who tells everyone in the school, I pee out of my belly button. Some kids really find that funny and humorous and they like it, and other people don't respond well, and then he knows who the people he wants to be friends with are. I've had other 17-year-old girls tell me, I haven't told anyone in the school because I know that people my age aren't that mature and kind. So I tell people that I really care about, I go to youth rally, and I have my community. I've also experienced some school-age kids decide, I'm just going to tell 2 or 3 people that I really trust. That's how I'm going to cope with it. I'm not going to tell them all the details, but I'll tell them a few. Medical trauma or medical stress, surgical interventions, urodynamics, painful irrigations. There's lots of things that people with bladder exstrophy cope with every day that only somebody with bladder exstrophy would truly understand. Fear of health problems, fear of having kidney infections, fear of potentially needing further surgery or complications from surgery, and hospitalizations. I think oftentimes as medical providers, we underestimate how traumatizing and stressful it is to leave your home and live in a hospital setting with no privacy for a period of time. And I've heard from a lot of parents that one of the biggest fears they have when their child is born is the fear that their child might be mistreated for their difference at some point. And this is a human fear, right? A fear of rejection, a fear of people judging us. That's very normal. But when we know what our difference is, sometimes we attribute that fear to that. I've had some parents and some kids worry about bullying, worrying about people judging them for their difference. And grief. We often underestimate the loss of having imperfect health. Grief can look very different. We know that it can look like anger, it can look like depression, it can look like avoidance and numbness. There's all different ways that we cope with all these different stressors, some of them helpful, some of them not helpful. And as a mental health professional with Dr. Montano, we felt that it was really important to give you some ideas of how we then get support that we need. I talked to a young woman with cloacal exstrophy the other day who said her biggest message to young people is to get help sooner. She went 3 years with feeling very isolated, very depressed, and very angry about her condition until she finally felt there was someone she was comfortable enough telling, I need some extra help. She's now in counseling and group therapy, attends youth rally, and has found her positive community. She's discontinued talking to people who have very negative views of the world. She's practicing meditation and mindfulness and things that Dr. Montano will talk about more. So different symptoms that we wanted to just outline that additional support is needed. We know that there's a stigma about getting mental health support in our culture, right? And so it's important to see that some of these symptoms are very, very normal for the human experience when the external demands are greater than our internal strength. So this can look like angry outbursts and irritability. Oftentimes with kids, their depression and anxiety looks like anger and emotional dysregulation. Avoidance of social activity and previously enjoyed experiences. Unfortunately, some people, their anxiety becomes so great that they have panic attacks. They might have physical symptoms related to their emotional symptoms. Sad on most days. And cognitive distortions. So I'm really upset about having bladder exstrophy, so my whole life is terrible. One of the things that I've learned most from the teenagers is when they talk about how they're angry that they have bladder exstrophy or they're upset that they have it and it's something that they're grieving, people saying, well, it could be worse. You should be grateful for what you do have. And unfortunately, this can be really hurtful because it minimizes the experience of what a teenager is enduring and how difficult their particular lot is. There's many other symptoms. This is a short list, but there's definitely a lot of avenues, and the good news is that when we're having a difficult time, coping, our brains are malleable. We can change our emotional status and our thought processes, and Dr. Montano will speak more to that.
Good morning. I'm the psychologist here in the Division of Urology, and we're really excited to have all of you here today. So now you realize you need a little bit of extra support. Where do we go to find that support? So some of the places that where we can look for help is with your Not all divisions of urology have a psychologist, but if they do, reach out to them or a social worker like Emily Haddad and I. You can ask your pediatrician for a referral, and a lot of times pediatricians also feel comfortable prescribing medication if that's the route that you want to approach as well. And a lot of times I know it's like, oh no, more medication, or we heard about all the side effects, but I would encourage you to just ask, what are the side effects? What would that look like? Because a lot of times medication can take the edge off or can help us participate in therapy better and take advantage of those things that our therapist will teach us and work with. You might also go on psychologytoday.com. What's really neat about that website is that you can filter based on what you want the specialty to be, the age group that you want the therapist to focus on, even the type of degree and your type of insurance, and location as well. So really finding someone that fits your needs and it's in your area. Also, you probably all hate to hear this, right? Call your insurance, but it's true. They will be able to refer you to a therapist that accepts your insurance or that can cover the type of insurance that you have. Some of the types of providers that you might encounter that can help you with coping or with mental health issues are a psychologist like me, a licensed clinical social worker, a marriage and family therapist. They would do what you think about traditional therapy. You go to their office, you talk, you work on different activities. The other type of provider might be a psychiatrist. So I know a lot of people get confused with psychiatrists and psychologists. So a psychiatrist goes to medical school, they have an MD, and they prescribe medication. A psychologist is not an MD and does not prescribe medication. So I would say that is one of the biggest differences, and a psychologist would do more of the therapy of a 50-minute, 1-hour session. A psychiatrist would be more of a usually traditional medical provider. Okay. So Emily and I wanted to give an overview of what might you expect when you go to therapy, if and when you go to therapy. Also, something really important, I think, to keep in mind is that if we go to therapy, it doesn't mean we're going to be there forever, right? It can be short-term. It can be, my child's having a urodynamic study. I just need them to be prepared for that. It might be a big surgery is coming up. I need support to prepare for that. So it's flexible. I think sometimes people are like, oh, if I start, I'm never going to end, and it's not like that at all. Okay. One of the most common types of interventions is cognitive behavioral therapy. You might have heard of it. It has a lot of evidence for its effectiveness, for depression, for anxiety, for children, for adults. So the premise is that our thoughts affect our emotions and affect our behavior, and they all affect each other. So if we're able to change one of these, usually a situation where you don't have control, but think about thoughts, emotions, and behavior. If we change one of these, we can impact the others. A lot of times we can't change our emotions, right? If I tell you, okay, everybody, feel happy. If you're not in that mood, you can't do that. It's hard. So a lot of times in therapy, we start with the thoughts and the behavior. So let me give you an example. Okay, I'm going to go with a urodynamic study. We're all familiar with that. I'm having a urodynamic study. I'm thinking it's going to hurt so much. My behavior, I'm going to start crying. I'm going to kick, and I'm not going to let anybody put a catheter. And my emotion is going to be anxiety. So let's think about changing one of those. Our thoughts. Instead of thinking it's going to hurt a lot, it's going to hurt a little bit, and it'll pass. And we can talk about, so the idea is that when we work on changing our thoughts, a lot of times we jump to the opposite. So when I work with patients, you probably have the same experience, we talk about, like, hey, what's a more realistic thought? And they'll say that it's not going to hurt. That's not realistic, right? Because then when they do it and it hurts, then the trust is gone and they're like, okay, that wasn't real. But if we work on being more realistic, on it might hurt a little bit and it will pass, I can do it, it will increase self-efficacy, and kids will also trust us as providers and trust you as parents, right? Because, oh, you're right, and it did pass, and it did feel better. Some of the, we call them thinking traps, the thoughts that we want to change, and one of them is catastrophizing, for example, which is a really common one, especially when you're anxious. And it's exactly how it sounds like, that you think the worst is going to happen. And when we're anxious, that's where our mind goes, right? It's going to be horrible. Also, what I've learned a lot is a lot of kids think they can't do it, and they can't handle it. And we'll talk about how we can really work on that self-efficacy and that they feel, you know what, I'm scared and I can do it. That's what brave means, right? Brave doesn't mean not being scared. It means I'm afraid and I'm going to do it and I'm going to face that fear. So yeah, one of the thoughts like catastrophizing is, for example, if I fail this test in school, I'm never going to go to college. Well, there's a lot of steps in between. Some of the ways that we work on changing our thoughts might be like, what is the evidence? What is the likelihood of that happening? So really working on, I talked about more realistic thoughts. And I'll talk about more of the behavior when we talk about exposure. But for example, with depression, a lot of times we want to be in our rooms, don't want to talk to anybody. So the behavior that we might change is actually, you know what, we are going to go to the store. You are going to come to dinner with me. It's called behavioral activation. So you even start those behaviors before you start changing the thoughts and all of that. Okay. So some of the other specific interventions that you might work on is relaxation and distraction. So when we think about that cognitive triangle and the behavior piece, also let's think about our bodies, right? So when we're anxious, for example, some of us, our heart starts beating really fast. We start sweating. We get headaches. Some of us get butterflies in our stomach or stomach aches or get nauseous. So these relaxation our muscles get tense as well, right? And as you will learn on Sunday, our stress and our tension also really impacts the pain we experience. So we're able to relax our body. We can do a lot of these other things like changing our thoughts and really facing our fears a lot better. So the most basic thing that we can all do very easily is take deep breaths. It has a lot of evidence as well as really helping our bodies calm down and making us feel a lot better. And at the end, we're all going to practice together. Because I think you're all coping with a lot this weekend, meeting a lot of new people, separating from your 8-year-olds and up to go on the field trip. So, I invite you to practice what we learned today throughout the weekend. So diaphragmatic breathing is really using your diaphragm to take deep breaths. So instead of taking shallow breaths with your chest, imagine you're filling up your belly like a balloon and really taking that deep breath. And the idea is that you blow out very slowly, and that's what's going to make it effective. And what helps kids remember is smell the flowers, so you breathe in through your nose, blow the candle. I also like smell the cupcake, blow the candle, to go with the theme. You can choose, but it's a really quick way of remembering. And I made little cards for this to put in the coping kits so your kids can remember to do it. Another thing you might learn with your therapist is guided imagery. So the idea, you might also hear the people call it your safe place, your calm place. The idea is that you use your 5 senses to imagine you're in that calm place. So for example, the idea is that you're going to build your toolbox, right? Maybe imagining you're in your calm place during class might not be the best because you should pay attention. That would be a good time to take deep breaths. But maybe if you're going to get a blood draw, that would be a good time to do guided imagery. Or if you're going to have an invasive test procedure done, that would be a good time. So we like to encourage children to use their 5 senses, and adults too. So what do you see in your calm place? What do you hear in your calm place? What do you smell? What does it feel like? So a lot of people like the beach, the sand in your toes, the warm sunlight on your skin. And if there's anything to taste, we have them explore that as well. And the idea is that you're imagining you're there. So it's a way of distraction, but it also helps relax our bodies. Another thing you might learn is progressive muscle relaxation, and it's that third little guy over there. So the idea is that when we are tense, our muscles are tense, and we might not even realize it. So what you do in progressive muscle relaxation is go through every muscle group of your body, tensing and relaxing. If you can recognize the feeling of tension, then you can relax it. You'll have more control of that. So we teach that to the kids. For little kids, we'll do something like squeeze the lemons for 5 seconds and let it go. Get a fly off your nose, and then you let it go. Imagine a baby elephant's going to step on your tummy and make it tense, and then you let it go. And a lot of the kids don't want to do the whole body, so they'll choose I squeeze the lemons, and that's their coping strategy. Another type of intervention is exposure. So this is the type of treatment that has the most evidence for anxiety. And what's funny is that it actually makes you do that thing you're scared of. And I'm talking a lot about anxiety because I think this is something I see a lot, especially with the younger kids. We do so many invasive things. We have a lot of procedures, and some of them are painful and scary, and that kind of sets up the stage for the later ones, right? Like, no, the last time it hurt a lot, and it's going to keep hurting. Again, those thoughts that are created based on our experiences as well. So the premise with exposure is that avoidance maintains anxiety, right? So think about this. There's this scary thing. I avoid it. I stay calm, so it reinforces my avoidance. But by avoiding it, I don't give myself an opportunity to realize that I can be okay and that I can handle it. So I'm going to stay anxious by never doing that thing that's scary to me. So what we do in exposure is we do graded exposures or systematic desensitization. So I put the steps there because the idea is not throwing you in the deep end. It's dipping your toe first and then dipping your foot until you feel comfortable with every step. And the idea is that it allows the person who's doing exposures to gain mastery and self-efficacy with each step. Imagine if I throw someone in the deep end, it's so scary, I'm never going to do that again. But you dip in your toe and you see that it's okay. All right, let me put my foot in. You know, and that's the idea that then you can get to your goal, which is catheterizing, for example. So what would that look like? Let's say someone is going to start catheterizing and they're really scared. I'm not going to do that. That's going to hurt so much. First session, let's look at it. What does it look like? Let's play with it. One of my old supervisors, she would have kids make necklaces with their catheters and really change the association that they have with that scary thing. You know, what is that? Then maybe the next day they'll, I don't know, put it on their belly and just sit there for 2 minutes. You know, and that's the idea, little by little until they gain mastery and feel more comfortable. And the first step is actually to learn some of the coping strategies and relaxation. So when they're doing these exposures, they know what to do. So we're not going to throw them down the hill without brakes, right? We're going to give them brakes and then we'll push them down the hill a little bit. So what's the idea with exposure? It's an opportunity to create new associations. So like we talked about relaxation with the feared object. So, oh, I'm in front of this scary thing, but I can keep my body relaxed and I can do something about it. It also helps reduce learned associations like I talk about. It also increases self-efficacy, that you can control, confront your fears and manage your anxiety. Again, giving that opportunity that, oh, I can do it. Because our anxiety is telling us you can't do it. You can't handle it, it's scary, you can't do it. And then you can also learn that over time that anxiety may decrease. So really what happens when you face your feared object, your anxiety will go up, but then it will go down. And by facing it, you give yourself the opportunity to see that go down. And something that I didn't mention here is that when we work with children, we're also going to work with parents. Your children are looking to you to see how they should be feeling. You know, you're the referent. So, oh, my parent's anxious. This is something scary. I should be scared. So you are a big tool for your children to feel brave and strong and that they can do it. Okay. Another type of intervention that you might hear about is mindfulness. So the idea, John Kabat-Zinn created or mindfulness, or came up with the theory of mindfulness. Mindfulness means paying attention on purpose, in the present moment, and non-judgmentally. And it's really a way of controlling your attention. So think about, have you ever driven home and you don't even realize how you got there? Right? You're on automatic pilot and you were thinking about, what am I going to make when I get home, the kids' schedules, you know, something that's stressing you out. We're in our heads a lot and we're not in the present moment experiencing what's going on. So I love this picture. It's a person with their dog, right? The person is just thinking of everything that's stressing them out. What's going on? Always in the future and the past. Oh, I shouldn't have done that, guilt, whatever. Or what's going to happen? How is that going to go? The dog is like, look at the trees, look at the sun. The dog is being mindful. So I invite you
To be a dog.
to be a dog. We can learn a lot from our dogs. So, I mean, I think mindfulness we hear a lot with like meditation and it can be really intimidating. But with mindfulness, you can do it with anything. You're ironing. Oh, this is warm. Look at how the wrinkle flattens. Look at the color of the shirt and focusing on what you're doing in the moment. Washing dishes. How does the water feel on my hands? Oh, it's warm. Look at that bubble. focusing exactly on what you're doing is a way of being mindful as well. And you will see how surprising, I mean, one time I was making jewelry for a group, and then I stopped and I'm like, oh, I feel so relaxed. I just realized I was so focused on the jewelry and what I was making that I wasn't thinking traffic, what am I going to do when I get home? So it's really a way of being present, and it helps with also relationships, right? I'm going to be a better listener if I'm present. I'm going to be just more in tune to my surroundings and other people. So I invite you to be a dog. All right. So now we get to practice deep breathing. This video it's a little different. It's a 4-7-8 breathing. The idea is that you're going to breathe in for 8, hold it for 7, and breathe out. No, breathe in for 4, hold it for 7, breathe out for 8. I tried to do it yesterday, and it's really hard. So I invite you to try your best, but the idea is breathe in and breathe out slowly. Okay, but this is an opportunity for all of us to do it together and really set up one of your coping tools for the weekend. Sorry. No?
All right, class, let me ask you something. When you're nervous or afraid, what is your breathing like?
I guess I breathe faster.
Yeah, me too.
You? Right, you tend to take short, quick, shallow breaths that make you feel worse. Well, today I'm going to teach you how to take long, slow, deep breaths that will help you calm down when you feel nervous or afraid. And if you practice this breathing exercise regularly, you will be able to train Whittle to be calmer.
Oh, I like the sound of that.
This is called 4-7-8 breathing. So you want to start out by sitting straight up like this. Now, a lot of times when we breathe in from our chest, up here. But today we're going to breathe from a lot lower, from our diaphragm. What? Your diaphragm is right here, by your stomach. Think of it as a balloon underneath your ribcage. Oh, okay. First, you breathe in through your nose for 4 seconds. Take a long, deep breath, like you're filling up that balloon in your stomach. Then we're going to hold it for 7 seconds. And finally, we're going to slowly exhale through our mouths for 8 seconds. Pretend like there's a tiny hole in the balloon, and all the air is escaping from your mouth. Ready to try it all together now?
I think so.
Yeah.
Okay, wait, no. Let me take a deep breath first. Okay. Ready? Great. Everyone sit straight up. You can follow along with us if you like. Now, take a deep breath through your nose for 4 seconds. 1, 2, 3, 4. Good. Now hold that breath for 7 seconds. 3, 4, 5, 6, 7. Excellent. Now slowly release that breath. We'll count 8 seconds. 3, 4, 5, 6, 7, 8. Good job, guys.
I have a question. What if I can't hold my breath for 7 seconds?
It's okay. It just takes a little practice. Do what you can for now. Let's try it one more time. Breathe in through your nose for 4 seconds. Hold for 7 seconds. And now slowly breathe out for 8 seconds. Great job, class. You should practice this breathing exercise every day for about 5 to 10 minutes. Eventually, you will become calmer and make Whittle stop throwing tantrums every time you're anxious or afraid. Yeah, this is going to work a lot better than hiding under the covers.
And one tip, practice when you're relaxed. It's like a fire drill. That way when there's a fire, you know what to do. Okay, so practice before bedtime maybe. Thank you.